Welcome to Innovators Journey, the show where we explore the bold ideas and breakthrough thinking behind innovation that moves industries forward. I'm Nick Franck. Today I'm joined by Dr. Albert Chin, co-founder of PercAssist Inc. He has spent his career at the intersection of engineering, medicine, problem solving. His work focuses on advancing minimally invasive approaches to cardiac support technology, and his career reflects a deep commitment to rethinking how complex medical challenges are addressed through thoughtful design and innovation. Dr. Chin, thanks for joining me today.
Yeah, I'm glad to be here, Nick.
Okay, let's just dive in. Tell us about the medical innovations that you're working on and that you're a part of.
Most of the innovations that I'm involved with have been in the cardiovascular field. The reason being, 48 years ago, as I was preparing to apply to medical school, I thought I wanted to do some research to bolster my application. So I called up this cardiovascular surgeon named Tom Fogarty. And he's the most famous surgeon-inventor ever. Now, unfortunately, Dr. Fogarty passed away 12 days ago. But I called him up, and the greatest effect on my career was because of Dr. Fogarty. And so I'd watch him operate such critical surgery. I thought I'd like to make an impact in that field. The first day I met Dr. Fogarty, he was the first inventor of the first balloon catheter. And so if you take a balloon catheter, you can see there's a plastic shaft. And he was telling about balloon angioplasty. And if you have a narrowing in an artery like this, and you try to put the catheter through, you can't, because the balloon, it's going to be stuck proximal to the narrowing. 4 days after I met Dr. Fogarty, I came up with this idea, which is a balloon inside a catheter. And when you pressurize it, the balloon unrolls and finds its own way through the stenosis. So that was my first invention. And 30 years ago, in continuation to look at cardiac surgery, I came up with a simple way using an endoscope and this nose cone, which is transparent. This was used to harvest the saphenous vein. So they use a saphenous vein, which runs from your groin all the way down to your ankle, as a graft for coronary artery bypass surgery, because nothing else will stay open. So all these patients had this big incision down the entire length of their leg. And since 25 to 30% of patients who need coronary artery bypass are diabetic, they had difficulty healing that incision. And that incision hurt more than cracking your chest open. And so this was a huge problem. And so I came up with this simple device to be able to take out the entire length of the vein through a 1-inch incision. So this is one of my favorite designs because it's been used in over 3 million patients since I did the first case. And probably 90% of all coronary bypass surgeries in the U.S. use this. Right now at PercAssist, what I'm doing is something that's extremely critical because in the U.S., there's 80,000 patients who are in end-stage heart failure who need a heart transplant. But there's only 2,000 donor hearts. There's artificial hearts that can be implanted, but only less than 3,000 of these are done every year. And so you have 75,000 patients who are in pain. They can't breathe, they can't walk, and they're under only medical management, which is suboptimal. And so I was thinking about a way to help these patients and do it in a non-surgical fashion because these patients are too sick to really undergo a large procedure, general anesthesia, as well as open heart surgery. And so at PercAssist, what we are doing is, if you have a heart here, I'm using a balloon to go over the left ventricle. We anchor the balloon in this position, and so the balloon is behind the sternum. The balloon is about 130 cc's in volume during inflation. Now, this balloon can be put in through a puncture underneath the sternum. So it's called a subxiphoid entry. And so it doesn't require surgery. It can be put in the cath lab. And so this is going to be really impactful. And we've done 7 patients to date.
Incredible. You've created and invented all of these different things. You mentioned after meeting Dr. Fogarty, you created that invention within 4 days. What does that innovation process and invention process look like for you? Like, what is your approach to that?
So it's interesting because I had a background in mechanical engineering. I did my undergraduate at MIT and was fortunate to be able to take machine shop courses and so on. So I make all of my own prototypes. And so I get a prototype and demonstrate it as functional. And after MIT, I went to Stanford to do my master's. And there they emphasized visual thinking, which is perfect for kind of biomedical applications and surgical applications, because if you take a look at the anatomy and physiology, the ability to get access to internal tissues and then to manipulate the tissues, it requires kind of a lot of visual thought as to what is the approach and the technique. Right. So the approach I do, and I think about this 24 hours a day, I go through my mind and think about a technique, what it would take, and what would help me out in doing a procedure. And so that's the thing. And then the other thing that is really important besides function is simplicity of design. So I try to make a design that is as simple as possible and functional. Why? Because it's going to be easier to manufacture. It's going to be easier for the physicians to be able to look and assimilate a technique using a simple device.
Yeah. Well, and I appreciate you bringing the visuals. It was really cool to kind of see what you're talking about and what you've put together. When you think back over the course of your career, the things that you've invented, your vision for even the next handful of years and what you're working on right now, like, how do you feel like all these elements have come together to shape the impact that you want to make in the medical field and patient care?
Well, there's always going to be all these critical problems. There's so many that are unsolved. Take heart disease, cancer, diabetes, obesity. All of these we can still address and will address in the future. And so that's what makes me excited, is being able to get up and think about these and to derive solutions over time.
Yeah. Dr. Albert Chin, thank you so much for coming on, sharing the work you're doing and how you're pushing these boundaries of medical device innovation.
Yeah. Thank you so much for your assistance, Nick.
Awesome. Well, hey, if this episode sparked your curiosity about innovation at the intersection of engineering, healthcare, follow the show, share with someone who loves seeing these big ideas turn into real world solutions. Once again, thank you to Dr. Albert Chin for joining me. I'm Nick Franck, and we'll catch you for the next Innovators Journey.